Recent studies show Alaska Natives and American Indian people suffer more often from depression and cases of mental illness than any other group in the country. Twyla Fairley has struggled with a number of issues throughout her life. Her parents tried getting her into specialized treatment for Alaska Natives, but the wait list was too long. Instead, they had to find other avenues of treatment.
I draw, sometimes I sketch.
18-year-old Twyla Fairley has had it rough. An Alaska Native, she was born with fetal alcohol syndrome and spent much of her time living in the shadows.
It's because of my mentality. I have FASD and ADHD and depression and anxiety, which makes it really hard because my ADHD distracts me. FASD is I think, the mind.
But you can't always say what you think.
Yes.
Twyla's family says she also has a problem controlling her sometimes violent temper.
The anxiety, depression, and then just the anger that she just doesn't know how to control or deal with.
As a result, Twyla is now at the McLaughlin Youth Detention Center, but she is no stranger to experts and institutions.
My adoptive parents were they tried to shelter me.
Throughout her life, Twyla and her family have battled her mental illness. Taking her to therapy and private psychiatrists, nothing seemed to work.
They tried, but it was they didn't know how to deal with my emotions, my anger, my frustrations.
Then, in 2020, Twyla was sent to a mental health facility in Texas for 11 long months. It was during COVID, so parental visits were not allowed.
I didn't see him at all, except for on Zoom.
On Zoom?
Yeah.
And what was that like?
It was really hard because you can't really hug your family on Zoom. You can just wave, say hi, I miss you.
But even workers there couldn't seem to get through. So when Twyla returned, her family searched for support in Anchorage.
I just hope that there would be a lot more facilities that would open or that would start coming here or something like that.
That's probably one of our biggest challenges here is simply the lack of residential treatment programs.
Mindy Gorchenko is a nurse practitioner at Providence Hospital. She says Alaska struggles to find resources to handle complex cases like Twyla's.
Given the incredible amount of children who are being affected by mental illness, it is often the case that children have either a very long waiting list or they are being received into the emergency department, evaluated strictly for safety, and then sent home, simply because there aren't enough beds, there aren't enough spots in some of these higher level facilities.
A study released by the Centers for Disease Control found the need is there. In 2021, Alaska Natives and American Indians registered the worst on key mental health markers, seriously considering suicide, making a suicide plan, and for attempting suicide. But Twyla says McLaughlin is actually helping.
It's given me an insight of what was going on before I came here. What I want to do with my life is to get a job, to be happy.
And Twyla will be a senior next year and plans to graduate and then go to art school. She's now 18, so she'll be leaving McLaughlin soon. She's currently on the waiting list to go to Presbyterian Hospitality House, where she expects to spend the next 4 to 6 months.